First things first, we have 7,125 cases. That's 403 new cases since we last reported to you. That's 3,630 active cases across the state. I am very sad to have to report to you that 49 people have now died. That's 5 additional fatalities due to this virus since yesterday. I can't provide too much detail about each of those, but to the extent that I can, let me just run through those 5 individuals. There is a male in his 50s, there is a female in her 70s connected to aged care, an aged care setting, a male in his 80s, again connected to aged care, a male in his 90s connected to aged care, and a further male in his 70s not connected. So the person in his 50s and the person in his 70s are not connected to aged care settings. We send our best wishes and our support to each of those families. This will be a terribly challenging time for them. They're in our thoughts and prayers. Of those 403 cases, 69 are connected to known and contained outbreaks. 334 are under investigation by our public health team. There are 201 Victorians in hospital, 40 of those are in intensive care. In terms of testing, we have pushed through the 1.4 million barrier, so 1,413,115 tests since January 1, 27,151 tests since yesterday. Again, thank you to all of those who've come forward and got a test. It is critically important that we have those with even the mildest of symptoms coming forward, getting tested. Those results tell us where we have to work hardest and where we have to make sure that we are doing everything to contain the spread of the virus. In terms of metro regional split, and there'll be some further updates with absolutely definitive numbers. There's still a few cases being examined, but it's roughly 370 metro and 13 odd in regional Victoria. That takes to about 113 cases. That's how many active cases there are in regional Victoria at the moment. So smaller numbers there. Some of those are absolutely connected to well-known and well-understood and contained outbreaks. But we are still seeing some cases in regional Victoria, and some of them I know because of the outbreak settings are challenging, but we are not seeing the sort of growth in regional Victoria that would see us change our settings dramatically, and that's pleasing. I've on a number of occasions talked about the prospect of easing restrictions in regional Victoria at an appropriate time. We simply won't have that option available to us unless we continue to see those numbers low and in fact drive them down even further. That's why, obviously, to every regional Victorian, you have not got the same rules as Metropolitan Melbourne and Mitchell Shire, but there are still rules, and that's why it's important to follow those. You're not required to wear a mask, but if you get out and about and you don't think you can maintain that 1.5 metres, then we'd ask you to wear a mask or a face covering, and of course all the other rules around hand hygiene, cough etiquette. If you're feeling ill, even mild symptoms, please come forward and get tested. There are many different test sites right across regional Victoria. Now, just following up from some of the data that we shared with you yesterday, some of the pretty obvious points that come out of that, the number of people who are waiting too long between when they first get symptoms and when they present for a test, and then a number of people, around half, who once they've had their test taken are not isolating at home. They're still going shopping, going to work before they get their test result. As a direct response to that, because we do think that insecure work, the notion that if you don't work the shift you won't get paid, there's no sick leave, there's no other entitlement you can fall back on. Today I'm announcing that via the coronavirus hotline, which again 1800 675 398, 1800 675 398, a payment of $300 will be available to anybody who has taken a test and then needs to isolate until they get their test result, is in work but does not have sick leave that they can fall back on. So this will be as quick a process as we can possibly make it. It'll be a relatively simple and easy process. It essentially requires you, for instance, to provide a pay slip. If you're in a position where you're not able to do that, then a statutory declaration to that effect which will be done as simply and as easily as possible. Paperwork's always important, but it's about making sure that we get these payments out as fast as possible. What we've got at the moment is people who feel unwell but don't want to go and get tested quick enough because they're fearful of not being able to go to work. This $300 payment will go a long way to supporting those families and having them make much better choices. If you're sick, get tested quick and then isolate until you get the test result. If you were then a positive case, then you would be eligible, because those same insecure work circumstances apply, you would be eligible for a further $1,500 payment, and we would make sure that we made those payments as quickly as we possibly could as well. There'll be some further administrative detail, and if we need to clarify any of this, we obviously can do that offline, but this is about trying to make sure that there's that wicked choice between feeding your family, between providing for your family as an earner, doesn't compromise or see you making bad choices for every other family across our state. So this ensures that people are no worse off, and in fact that all Victorians are better off, because we know that these patterns of behaviour are driving many of the cases. They are contributing in a very clear way to the growth in cases that we have seen over these last few weeks. That's not a matter of judgment, it's simply understanding a problem, doing the hard work to understand that, and then developing a package of direct financial support that I think will be impactful, will have a real impact on many of those people, hopefully all of those people who are making a judgment that they've got to go and work the shift, because if they don't, they simply won't be paid, and that'll make it very difficult for them to provide for their loved ones. I just want to make a couple of other points in relation to where we find ourselves at the moment. Essentially, the ref number, so the number of people that a positive case infects, is around 1. I've had a whole series of meetings last night, a whole series of meetings this morning with all of our public health experts, trying to get the clearest understanding of where that number sits. The thing about it is, if the ref number, if that R0 number, so the number of people that a positive case infects, stays at 1, then we will see stable numbers, but we will not see falling numbers. If, however, instead of every positive case infecting one other person, only every second positive case infected another person, so if we halve the rate, so it was at 0.5, then we will see our numbers come down and come down again and again. That's where we have to get to. This morning I've had, as I said, a number of detailed meetings when it comes to support from Medibank Private, Ambulance Victoria, the Australian Defence Force, a whole range of other Victorian government agencies, whether it be in initial interviews, contact tracing, data management, across the board. Across the board, we shouldn't forget enforcement, compliance, the work of Victoria Police with support from ADF. This is a second wave that's all about the 1 and 2 percenters. It's all about the small things, the small improvements in our internal processes and in terms of compliance across the Victorian community that add up to not just a replication rate at 1, but all those small and hard-won gains that will see that replication rate come down, and then to see case numbers come down as well. It's a massive team of people that are working hard day and night. We're so grateful for the support of interstate agencies, Commonwealth agencies. Let the ADF play a really significant part. We're towards about 1,400 people that are on the ground now doing all sorts of different tasks. But let's not forget those Commonwealth public servants as well. They may not wear a uniform, but they're there supporting us as well in lots of different ways also. But of course we're grateful to the Victorian community also for coming forward and getting tested, for following the rules. All of these things are critically important. If we want to have businesses reopened, if we want to get back to something approaching normal, albeit a COVID normal, then we can't continue to see stable numbers. We have to drive those numbers down. And back to the original announcement I made, if we can have a much higher percentage of people come forward as close to the onset of symptoms to get tested and then isolate, that means the number of exposure days, the number of days that you were at the height of your infectivity and you were just going about your normal business, will be not 3 days, it'll be but a fraction of that. And that means you will, logic just tells you, you will infect less people. You will pass this on to less people. That $300 payment's an important part of that. So too, vigilance in terms of coming forward and getting tested, vigilance in playing your part, following the rules. We're deeply grateful. I personally, not just as the leader of the government, but as a father, as a husband, I am deeply grateful to all of those Victorians who are wearing a mask. I'm deeply grateful to all of those Victorians who are making sacrifices, large and small, to get us to the other side of this.